In this video, we shall be discussing regarding a few important aspects of the surgical anatomy. So we start with the basics. The weight of the normal thyroid gland is your 20 to 25 gram. So this has been previously asked as your MCQ, hence the purpose of putting it over here. Right. Now the functioning unit of the thyroid gland is your lobule. Now, this is supplied by your single arteriole, and there are 24 to 40 follicles lined with cuboidal epithelium. Now, if you look at this histology picture, which is of your normal thyroid filled with your colloid materials, right? So these are your few basics questions from anatomy that have been asked, and hence you should not be missing on them. Now, regarding your blood supply of thyroid gland. Now, this is a very important aspect because when you come down to the surgery of thyroid gland, this is where it comes to play a very important role. Now, the first important blood supply is your superior thyroid artery. Now, your superior thyroid artery, what questions can they ask? It is a branch from your external carotid artery. Now, students often confuse over here it as a branch of the internal carotid artery. So no, my dear students, the superior thyroid artery is a branch of your external and not internal carotid artery, and the important part is that they divide as they enter your superior pole. Right. Now the next artery is your inferior thyroid artery. Now, the question that has been asked is your inferior thyroid artery is a branch of, yes, it is a branch of your thyrocervical trunk of the subclavian artery. Now, next question that is asked is regarding your thyroidema artery. Now, this is usually present in around 2% of the patients. And from where does it arise? It arises directly from the aorta or from the innominate artery. Right. So this is regards to your blood supply of your thyroid gland. Now regarding your venous drainage, so you have your superior thyroid vein. Now the superior thyroid vein drains into your IJV. Then you have your inferior thyroid vein. Now this drains into your innominate vein, and you have your middle thyroid vein, which arises from the lateral aspect of the mid thyroid lobes, and they again drain into the IJV. Now you can be asked a true or false question from the anatomy of the thyroid gland, where they can give you questions from your blood supply as a statement like the superior thyroid artery is a branch of your internal carotid artery, so you need to identify it as a true or false statement. Or they can give you the match the columns option, where they give you the superior middle thyroid artery and match the blood supply on the column 2, right? Now, after your this arterial and the venous blood supply, the questions that have been asked is with respect to your lymphatic drainage. So first it drains into the perithyroidal lymph nodes in the central group level 7. Now, they're often referred to as your Delphian lymph nodes. Right, and then they also form drain into the lateral group, which is your 2A, 3, 4, and the posterior triangle of the neck, which is your level 5B. Right. Now, the most important part in the anatomy is regarding your nerves, where they try to collaborate your anatomical questions with the surgical postoperative complications, right? So the recurrent laryngeal nerve is actually your most important nerve, and what it does is that it is the motor function of all intrinsic muscle except cricothyroid. Now, what happens if there is an injury of this recurrent laryngeal nerve? So, if there is an injury of this recurrent laryngeal nerve, the patient is going to complain to you with the hoarseness of voice, right? Then the next important nerve, which is important in case of thyroid surgery, is your external branch of your superior laryngeal nerve. Now, what does it supply? It supplies your cricothyroid, and it maintains the vocal fold tone or tension. So, if there is an injury to your external branch of superior laryngeal nerve, there is going to be the change in the pitch of voice. So these are few of your clinical clues that would be given into you question as a scenario based question, where you need to identify which is the nerve most commonly injured during the thyroidectomy, or they can directly asks you the question. Now, this recurrent laryngeal nerve is a very important nerve. Now, we need to identify this during our surgery. So, a few hints for your anatomical landmarks of your recurrent laryngeal nerve. It is your tubercle of Zucrandl, which lies anterior and lateral to the nerve. Then you have your berry ligament, and the inferior thyroid artery, which is at the level of your cricoid cartilage, right? So the nerve crosses the artery posteriorly and typically curves anterior towards ligament form before dividing posterior again into the laryngeal insertion at your cricothyroid joint, right? So these are your few important landmarks for your recurrent laryngeal nerve. Now I'll be showing you the diagram over here, which has been taken from the textbook of Sabestern, right, which is beautifully showing the anatomy of the thyroid and the surrounding structures. I would want you all to remember this diagram, as from this diagram they can actually just ask you to identify the particular structure, right? For example, this over here, if you see, is your internal branch of superior laryngeal nerve, whereas the one which is coming down over here to the superior pole is your external branch of your superior laryngeal nerve. Now you can see over here the superior thyroid artery, the inferior thyroid artery, the right recurrent laryngeal nerve. Then over here you have your thyroid cartilage, this as your cricoid cartilage. Then you have your middle thyroid vein, inferior thyroid vein. This is your thyroid ema artery, which we discussed is a directly branch of the aorta or the innominate artery and is usually present in 2% of the patients. And then we have your left recurrent laryngeal nerve. Now, a few important points regarding this right recurrent laryngeal nerve and the left recurrent laryngeal nerve. So, if you look at the right recurrent laryngeal nerve, where it recurs around the subclavian artery, right? Whereas the left recurrent laryngeal nerve, it recurs around the arch of aorta, right? So now what happens is that since the right recurrent laryngeal nerve is recurring around the subclavian artery, right, so it is to travel less distance, right, as a result of which nerve is more oblique as it reaches your tracheoesophageal groove. Now, in case of the left recurrent laryngeal nerve, it has to travel more distance. Right. Now, since it is traveling more distance, it runs in the medial plane. So how can this information be put up to the question? They can actually ask you regarding where does the right recurrent laryngeal nerve recurs and where does the left recurrent laryngeal nerve recurs, and which travels more distance and which travels less distance, as a true or false statement. Right. Now another important point that you need to remember is that now 2% nerve on the right are usually your non-recurrent and enter larynx from above. So these are factual based questions which you need to remember, right? And then another important thing that I want you all to remember is regarding your Beer's triangle. So this is a triangle which is used to identify your recurrent laryngeal nerve. So now what is this triangle boundaries made up of? Now it is made up of by your recurrent laryngeal nerve, which is found in your tracheoesophageal groove. Then your other two components of the triangle of your Beer's triangle includes your inferior thyroid artery and your carotid artery, right? So these are your few important points that you need to remember from the nerve of your surgical anatomy from the thyroid section. They can link your post-operative complications to your surgical anatomy and ask. They can ask you regarding your recurrent laryngeal nerve, where it recurs on the right and on the left, which travels the more distance, and one of the important landmarks to identify your recurrent laryngeal nerve, and the boundaries of your Beer's triangle, right? So this is all about the important aspects of the surgical anatomy of the thyroid.